welcome Dr. Tariq Yazir.
Thank you.
You are an honored senior member of the spine fraternity. The world of spine owes a lot to you, especially for all neurosurgeons in the Middle East. You are an icon, and it is my honor and pleasure to host you today in this World Congress. Welcome, sir. Please start your talk, sir. We are keen to hear you, sir.
Thank you. Thank you. It's very kind of you. To be here is really honored. Thank you. It's many thanks. And thank you. And I would like to share a simple case, but it's very, from time to time, the cases are teachers and the time is teacher, as all we know. And this is very difficult case for diagnosis. But UBE really a big chance for the patients and for the surgeons, in my opinion. These patients' complaints are quite large, so many. Walking is very difficult, getting more difficulty by time, distance and walking time decreasing. He had low back pain, the reflection of his pain on the legs, tingling in all legs, and he need rest when the pain increases. He could walk when the pain was gone. Also, he has coxarthrosis. He has spastic gait, and he was walking a heel off two strike position. His gait was unbalanced. And the patient is 78. He has diabetic polyneuropathy. He has mainly coxarthrosis, right side. He has cervical compression, and in 2099, cervical MRI has severe compression findings. There are myelomalacic cervical changes and stenosis in C4-5. There is also severe radiologic stenosis in L4-5. And one of the electroneuromyographic investigation outcome is diabetic neuropathy. EMG findings do not explain the patient complaints because the patient has spastic gait and bilateral Babinski signs positive. It is recommended to investigate central nervous system lesions. Second, electroneuromyography, a syndrome polyneuropathy, and it is compatible with the chronic part axonal degeneration, right L4-5, left L5-S1, and C6 and C5 segments. And of course, clinical correlation recommended by the neuromyography users. And some coxarthrosis and cervical position and some little details, but L4-5 segment like this, and neurogenic claudication, of course, very obvious. And within this diagnostic masses, we wanted to do UBE because all we know, the first rule of the medicine in Latin terms, we mustn't harm the patient. We mustn't do anything wrong for the patient. So UBE really is a big chance. UBE is not a small surgery. UBE is a very clever, very swift solutions. It's full of solutions. And the only approach like arthroscopy in knee, but you can do everything with the, everything you can do like an open surgery. That's why we didn't want to harm the patient, and we decided to solve the pain, clinical pain relief was our target, and we performed first UBE. And here, Dr. Hayati Aygun was in the operating room as a supervisor for me. and I would like to thank him very much. And this is the contralateral decompression of the medial facet osteotomy with medial facet osteotomy, and this is the small bone part of it. And we continued, and post-operatively he has a nice lumbar curvature here, and his gait really was much more better than before. And this is the control MRI, and the decompression was, the computerized tomography was perfect. And once upon a time, we used to use this kind of decompression surgeries. Today, I feel shame when I look at them, and we have a wonderful technique today, and I would like to thank to founder, innovator of this technique, Dr. Song, and his studies. And the patients are much more luckier than before. And I would like to thank the innovators, and to you, you are trying to share this technique with the world. Many thanks for your kind attention. Thank you.
Dr. Tariq, I don't have words to express my joy and happiness.
Thank you.
Being a senior person like you do and UBE, you are an inspiration to all of us. You know, I read a line recently by one of the best movie stars of old Hollywood. That series, Good, Bad and Ugly. And he, at the age of 89, is producing a movie. So he made a statement, don't let the wolves in. Mm-hmm. And that statement applies to you, sir. You did not let the wolves in. You did not let age defeat you. You, at your age, have adopted one of the most wonderful techniques known to mankind. And your words and your presentation today is an inspiration to the next generation to come. Amazing, sir. Congratulations and hats off to you. In India, I will with folded hands say salam. Salam.
Thank you. Thank you, sir. Thank you. It's very kind of you. Then I realized you are not only a wonderful surgeon, but also you have a golden made heart.
No, sir. It comes from you.
Thank you.